And I'm live again. This is Suburban Prepper. We'll talk about antibiotics for SHTF. And if you can't with doxycycline, it's a tetracycline family. It's a good antibiotic, bronchitis, mild pneumonia. It's good to keep on hand. Don't give it in children under 18. Don't give them any doxycycline. You mess up their teeth. Okay? One thing that we tend to forget are eye drops and ear drops. This is azithromycin ear drops or eye drops. Well, both. If you could put it in the eye, as far as antibiotics, you can put it in the ear, not the other way around. So an eye ointment can go in the ear just as well. Some more doxycycline. So it's good to have stuff on hand, different varieties. I have a fluoxacillin here. It even says here eye and ear drops. Azithromycin, which is a macrolide. Just go over different types of antibiotics. So what we have here is 500 milligrams of azithromycin, or back in the day known as a Z-Pack, which is not a Z-Pack. It's 3 tablets of 500 milligrams of azithromycin. And it's used for bronchitis. It can carry, if you're allergic to penicillin, truly allergic to penicillin, you can take erythromycin based, and it has the same therapeutics. Going through some other antibiotics here. I have antiparasitics, which I hope I never have to use. Tinazidol. I've only prescribed that once. And this is a cephalosporin, cefamine. So it's a different type of antibiotic. Cefamine is a cephalosporin. I got some nausea medicine here, Odansetron. What else do we have here? I have levofloxacin, which is for pneumonia, complicated pneumonia, levofloxacin. And helps with that. So as a medical prescriber, I can order medicines, some medicines anyway. And they always send tadalafil. But what I'm looking for is some of the antimicrobial. Here's some epinephrine. Shortage of EpiPens, but there's plenty of vials of Epi to go around. So it's weird. It's good to keep it on hand just in case. Flagyl. I keep some Flagyl on hand. You never know. Other ones that I have on hand are, it's like Septra to me. Yeah, it's a sulfa-based antibiotic. It's for urinary tract infections and some skin infections, some derm infections. Some more levofloxacin. And what do we got here? Omnicef, which is a cephalosporin antibiotic. And one thing that I want you to look at, this is C-chlor, is fluconazole. Here we go. Now this is if you develop, some women develop yeast infections after taking antibiotics. So I have fluconazole available. This is only for SHTF, and that's it. Some people take these fish antibiotics. I haven't seen where they have them. I've heard of erythromycin. I don't know if they have an erythromycin, because amoxicillin is not going to treat pneumonia. Okay. And for SHTF, you worry about pneumonia killing you. You need doxycycline, levofloxacin, or a Z-Pak at least for pneumonia. The other thing is doses. I have to think about our children. How to calculate the dose for a child, it's pretty complex. It's just a math equation. And then you're getting a child to swallow the medicine if you don't have it on hand. And then alternative antimicrobials. Honey. I'm a big proponent of honey. Excuse me, I'm not leaving yet. But I am. Try to get honey that's made as close as where you live at, and it has the antimicrobial properties. Okay, this was made in Michigan. I live in Northwest Indiana, so pretty close. Garlic has antimicrobial properties. And then preventative medicine. Wash your hands, don't smoke, try to exercise. What I don't have pictured or on screen that I showed are some of the augmentin and some Rocephin injections that I have. It's just for SHTF. And antibiotics are when not to use them. If you've been just feeling sick for a couple of days, okay, you're not running a fever, take some honey, saltwater gurgles. Because if it's a virus, antibiotics aren't going to do anything. And then people swear that they hasten the results. But, no. Save your antibiotics when you really need them. That's all I can tell you. And otherwise, you get resistant. The bacteria gets resistant with the antibiotic, and then it doesn't kill the bacteria, and so you don't get any better. For SHTF, what I would anticipate killing people would be wounds and pneumonia. So practice preventative care. Keep your hands clean. Clean wounds as soon as they occur. And the way I see it, I can barter my services in a SHTF situation. And then exchange it for what? I don't know. Something I would need. Excuse me. Well, I have a little sip of my go-to here. So good. No antibiotics. Antifungals is another one. I don't really have a lot of oral antifungals that I keep on hand. I have some topicals stored, but that's something to consider too. Yeah. So this is my second video. Even though nobody's watching me, oh look, Saved by the Bell. Hi, girlfriend. Anyway, antibiotics for SHTF. And what would you take? Okay, I mean, I've been doing this since I was 18, 19 years old when I was a medic in the Army. So, but you always learn. You always never quit learning. And oh, yeah, antibiotics for the puppies too. You know, how are you going to treat them? Maybe I should do a video on what books I use for my, we'll see. Okay, sweetheart. There you go. She likes to come up. Have a good day.